thing. So why can't a keloid scar be surgically removed? Well, it can. A keloid scar can be surgically removed, but it wouldn't necessarily be the first line of treatment for a keloid scar. And the reason for that is because a keloid scar is caused by an abnormal, your body is reacting abnormally to the trauma, whatever it was, and has scarred excessively. So the keloid scar is a problem with a person's physiology. Normally, there are some situations which can predispose to really hypertrophic rather than keloids. There's a bit of a spectrum with hypertrophic and keloid scars, but certainly with a hypertrophic scar, sort of a bit of a nuance, the difference between the two, but basically a hypertrophic scar is a bit like a keloid scar, but not as bad. But certainly with hypertrophic scars, there are certain things, like, for instance, if it takes a long time for the wound to heal, there's an increased risk of the scar becoming hypertrophied. So if you've got a reason for the scar to basically be lumpy, which is what we're talking about, lumpy scars here, there will be more positivity about removing it surgically, because you could say, right, well, if it took a long time to heal, that's why it's lumpy. If I can remove it and make it heal without it taking a long time to heal, there's a chance that it won't be lumpy. But if it would heal with no problems, and if it is really properly a keloid scar, then the worry is that we'll cut that scar out and give you a worse keloid scar. So that's why we don't like cutting out keloid scars. So often a keloid scar comes from a little thing. So you have a little thing, sometimes like an injection, blood test, tiny little thing, tiny little bit trauma, acne, ear piercing, tiny little scar, which goes massive. And then if we cut that massive scar out, we'll give you a bigger scar than what the original thing that caused the keloid was. And if that scar goes keloid, it goes even bigger than the first one. So that's why we are anxious about removing keloid scars surgically, and would try to do other means first. Things like massage, things like pressure, things like silicone sheets or silicone gel, things like steroid injections. Those sorts of things are usually done first, and surgery is reserved for really big ones, which we don't think are going to respond, or at least respond significantly to those non-surgical methods, or in situations where those methods have failed. But if you do surgery, as I say, we're always reluctant to do surgery because there's a risk that it could come back worse. So the way we mitigate that risk is we do what's called an intralesional excision of the keloid scars, which means you don't actually cut into any fresh skin. All the cuts are actually in keloid scar. So you're kind of debulking this keloid scar. You're making it smaller. So the aim is really to make a big keloid scar into a smaller keloid scar, which can then potentially be addressed with non-surgical methods like pressure and steroid injections to maybe get rid of the last part of it. So that's how I do it. I don't make any cuts in normal skin, so I do an intralesional excision. So it gives you a much smaller keloid scar, which we can then treat with steroid injections. But as I say, it usually is a last port of call, with trying the other things first if we can.